So the first type of surgery is the gastric band. The band has lots of names, but the official name is laparoscopic adjustable gastric band. The idea of the band is a minimally invasive procedure that avoids all the stomach stapling problems of the old-fashioned stomach stapling operations. You minimize complications by performing less surgery. It's very simple and easy, and it's done laparoscopically to avoid postoperative pain. The band is a device that we insert into the top of the stomach. We wrap it around the top of the stomach and then cinch it down, and then through a series of adjustments, try to find the perfect balance for each patient between losing weight and throwing up. If it's too loose, patients don't lose much weight. If it's too tight, patients throw up. And then over time with adjustments, keep it in that balance. So it's really not designed for everybody. It's designed for the active, exercising, motivated, disciplined person whose only problem is hungry. And if we help them with hunger, they will do the rest of the hard work of weight loss. The next surgery that we offer is the gastric bypass. The gastric bypass comes in many forms. The best gastric bypass, the gold standard, is the Roux-en-Y gastric bypass. We completely divide the stomach. We make a 1-ounce pouch. We leave the rest of the stomach in. We bring a loop up of small intestine and divide it and connect it, and what you're left with is a bypassed stomach. The results of this operation are that these patients lose about 3/4 of the extra weight. It's pretty quick. Reflux is 100% cured. Diabetes goes away very quickly. In fact, most of our diabetics leave the hospital off their diabetes medicines. And then the other weight-related problems go away with the weight. So sleep apnea, arthritis, anything that's directly related to the weight goes away as the patients lose the weight. The third choice in surgery is the sleeve. The sleeve, we cut the stomach vertically and we remove most of the stomach, and what we're left with is a tube or sleeve of stomach. These patients have a very extreme weight loss because the sleeve takes away hunger. Patients lose about 2/3 to 3/4 of their extra weight, and it's very similar to the bypass. All of our surgeries are done laparoscopically, which means little incisions. Those incisions heal very quickly, and pain is very minimal. Patients will spend 1 day in the hospital with us, so they'll spend the night, go home the next day feeling like they had surgery, but fairly decent, and within a couple of days, a week or so, right back to normal. So we do have a very strict diet after surgery for the first several months. So for the first 4 weeks, patients will be on a liquid diet that consists of protein shakes and non-calorie liquids. Once they're tolerating this well, over the course of 3 or 4 weeks, we'll advance them to soft foods. And as those are well tolerated over time, we'll advance them to solid foods. And eventually, by about 3 months, patients are eating normal foods: steak, chicken, pork chops, hamburger, barbecue, normal, solid food, but it takes them about that long to get there. It's in very small amounts, small measured amounts, and as they tolerate that over time, we advance the meal size to be larger meals to get them more nutrition in. So the question that many patients ask is, which surgery is right for me? I'm a firm believer in patient choice, so my job is to educate patients on the different choices, the risks, the benefits, the pros and cons, and then help patients make a wise choice for them.